let's get started then. This slide is based on a presentation that was created by Physicians for Social Responsibility for Maine. I'm on the board. I've been involved with the organization for over 30 years. And so, and I altered the talk and added obviously some of my own slides and so forth. But as they said in the Lancet in 2009, and the situation's only become more dire since that time, climate change is the biggest global health threat of the 21st century. PSR Maine is a small organization, and we originally created this report in the year 2000, and it's gone through several iterations since that time. And I've given this talk, I think this is the fourth time, and I'm afraid every time I do it and I prepare for it, I get more and more discouraged by the facts and information that I see. So I thought I'd start off with a little bit, at least, of, or shall we say, morbid levity. And this is a cartoon that was recently came out. So climate change is here. Which part of the country will become an unlivable hellscape first? The Northwest, the Northeast, the Southeast, or the Southwest? And the winner is everyone. There's no place to hide. And as they said in this recent article in the New York Times, climate disruption is now locked in. And their conclusion was that for a long time, there was so much focus on climate change, how would it affect the world's most vulnerable people like low-lying island nations or coral reefs, things that don't dramatically affect the economic powerhouses of the world. But that there's often been this arrogant assumption that wealth provides protection. And I'm here to tell us that I'm afraid there's no hiding from this problem. It's going to affect us in Maine, just like it's going to affect everybody else on the planet. Let's just see, I'm trying to go to the next slide here. Aha. Wow, isn't that interesting? Hold on. Oh, here's the next slide. Yeah, so this was a slide made by the federal CDC. It's sort of an animated slide, and it shows the various effects of climate change. Interestingly enough, though, it didn't really include drought, which I think is going to be one of the major factors I'm going to talk about tonight. But here you can see, and I'm not going to go through all this information. There's just too much information here, but you can see the increasing CO2 levels, rising temperatures, extreme weather, rising sea levels, drought. Those are all going to create myriad health effects. And I know when I talked to Joe earlier, a lot of folks are interested in that upper right-hand corner, which is the changes in vector ecology. And that's, I think, a relatively small part of the whole problem, but it's certainly a problem that has been affecting us in the Northeast, and I'm going to be talking about. The forced migration civil conflict is one that I'm going to be emphasizing a lot. And I thank Bev Roxby very much for sharing some information with me that was helpful to me in preparing this talk, which I'll share with you in a bit later. We'll just take a look at this slide for just a second and look at the myriad health effects that climate change is going to, the challenge it's going to provide for all of us. So the heat impacts are significant. If you look at the map on the right, that's not a heat map, actually, it's a change in temperature map. So interestingly enough, the northern states, which were cooler, are becoming much hotter at a faster rate than the states that were already fairly hot. That's, of course, true the further north you go. The Arctic has obviously warmed up a lot more than in any other part of the world. And if you look at weather fatalities, the red is, I'm sorry, the yellow is the 30-year average, the blue is the 10-year average, and the red, sorry, I'm mixing it up, but the red is for 2019, the most recent year that we have on record. But the interesting thing about this is you can see deaths from heat actually are greater than any of the other single weather events that we'll come across. I'm not sure why I can't get these there. There we go. Yeah, and so let's talk a little bit about vector-borne diseases. The mosquito is the most severe, most formidable animal in terms of deaths, the most formidable killer, other than perhaps humans. But the malaria mosquito is a very serious problem. And of course, there are many other mosquito-borne illnesses, but malaria is the one that causes the most deaths. And interestingly, the federal CDC was started in Atlanta because the American South was such a hotbed for malaria and yellow fever. And that's the reason why the CDC started in Atlanta. This shows you Lyme disease in Maine. Sorry, I'm just trying to move my things around so I can actually see my slides here. And you can see from the data that Lyme disease has been increasing rapidly. On this slide, you can see the rate per 100,000. The average for the state in 2019 was 161 cases per 100,000 people. But if you look at the bottom part of the slide, you can see in the gray, the rate for people over 65 is twice as high as that. And then if you look at the map to the right, you can see that Knox County has the highest rate in the state at over 500 cases per 100,000. And Waldo County is also one of the highest cases with rates from 250 to 500. So if you look at the elderly people over the age of 65, I should say, not elderly, sorry, and you look at people who live in Waldo County, then you're talking about extremely high rates. We're not only a high-risk population, but also a population that is in a very high-risk area. And this shows the breakdown for cases in 2019 in the counties in Maine, just shows the number of cases. But what I wanted to emphasize here was the number of cases of ehrlichiosis or anaplasmosis. I'm not sure how that's listed up here because I can't see the top of the slide, but at any rate, we're seeing about as many cases of those recently in 2020 as we've been seeing of Lyme disease. So that's a very severe problem too, and babesiosis is much less common. There are two other ticks that are coming into our neighborhood fairly soon. The Lone Star tick has spread throughout much of New England, and it's now found in southern and coastal Maine communities. And it's capable of transmitting a number of diseases, including the southern tick-associated rash illness and ehrlichiosis. It could also cause people to be allergic to red meat. And then the Asian longhorn tick is now in Connecticut, and it's capable of transmitting also numerous diseases as well. So that's coming our way. Weather impacts obviously are very severe as well, and we're all very familiar with the problem of hurricanes. And we know this is, every time I give this talk, it's like, well, you know, it's really a bad season for fires and hurricanes. Well, it's always going to be a bad season for fires and hurricanes, I'm afraid, from here on out. And mental health issues obviously are significant. We can certainly see that with the COVID epidemic and the increase in the murder rates in the urban areas. And it's obviously climate change is going to have massive effects in terms of mental health as well. And this is a bit of a difficult slide, and I won't try and walk you through it, but the bottom line of this is that minorities and people of color are at far higher risk for pollution, for exposure to severe weather, and for other problems than people like us, for example. And climate refugees is what I want to talk about next, because like other changes in climate, it's already happening. Northern Africa and Syria have seen, I can't get the exact numbers, but it's several million refugees since 2015. And Central American refugees also are very significant, as we know, trying to come into the United States. And it's estimated that 50 to 350 million climate refugees by 2050 due to sea level rise, drought and desertification, and scarcity of fresh water. This just shows you a map of the migration to Europe. But you know, if you look at the area of Mali and Niger, those places, the Sahel, south of the Sahara, are becoming increasingly desertified and unlivable. People can't make a living, and they're leaving their homes to try and go somewhere where they can. This shows migrations from Central America, and which, as we know, is also a severe problem and is going to get worse. El Salvador, Honduras, Guatemala have been terribly, the environments have been terribly degraded, and climate change has made it so people can't make a living any longer in agriculture. And they're moving into the cities internally and also trying to get somewhere else, primarily the United States, where they might be able to find a better life. Here's a migrant train traveling, Central American refugees traveling through Mexico. And I was fortunate enough in March to go and volunteer for 2 weeks down in Nogales, Arizona, and Nogales, Mexico. This is pictures taken of the border wall from the American side, and Mexico is just on the other side. I worked with 2 weeks with a Mexican nurse, and we visited the 5 major hostels, which accommodate refugees from mostly Central America who are trying to apply for asylum to come to the United States. The conditions weren't as bad as I thought they were, but the situation in the desert itself, when people actually cross the border illegally and try and go through the desert to get to Arizona, is just a terrible situation. So many people have died, and in fact, it's sort of the U.S. policy to make it as dangerous as possible for people, and so many people are dying in the desert. The case of Scott Warren, who's a geologist and a faculty member in Arizona, who is being prosecuted again. The first trial resulted in a hung jury. They're going to prosecute him again in November because he provided water and food to refugees in the desert. And what it says is humanitarian aid is never a crime. Remove the charges primarily against Scott Warren. That's one of the posters I saw when I was in Nogales. This shows changes in sea level rise. These are various estimates, but you can see sort of the middle estimate by 2050 is 1 meter. And if we look at what 1 meter is going to do, Bangladesh is a country of 161 million people. And like many other countries, much of the productive land is in the coastal plain. So when 161 million people can no longer make a living because of sea level rise, they're going to have to go to somewhere, and they're going to move around, as human beings have always moved around as a result of climate change. This shows desertification. We can see what's happening in the American Southwest, but many of the productive agricultural areas in the Americas and in Africa and Asia are becoming increasingly unlivable because desertification and heat as well, 2 double whammies. Look at India with 1 billion people. Look at China with 1 billion people. Worsening desertification, which is going to lead to mass migration. And this is the book that Bev shared with me, Rising Tides, very well documented about the situation of climate refugees in the 21st century. And I'm sure she'd be happy to lend it to you if you want to read it, but I think it's well worth reading and was great help for me. So this is sort of one of those slides you have to include. What can we do about this problem? Obviously, the problem is a political problem. And as you may know, I'm quite involved in the Citizens Climate Lobby, which proposes a carbon fee and dividend, which would tax carbon at the source and pay a dividend to every US citizen to make up for that, so that 2/3 of people would actually get more money than they would end up paying extra for carbon fuels based on that model. It's got a fair number of co-sponsors in Congress, but it's not very likely to go anywhere anytime soon. And the Maine Climate Council also didn't really advance that as a policy. And just finally, a couple of quotes. This is a critical time for public health advocates to demand that political leaders safeguard the health of the world's population, with particular advantage to the survival needs of the most disadvantaged. And then Pope Francis saying, a true ecological approach always becomes a social approach. It must integrate questions of justice so as to hear both the cry of the earth and the cry of the poor. That's all I really had to say in terms of the formal talk, and I'd be happy to open it up now for participants and see what other folks think and just hear your thoughts.
So thank you, Peter. So to keep this a little orderly, even though there's not a big crowd here, the simple best thing would be if you have a question for Peter, just simply raise your hand, and you can unmute yourself, or I'll unmute you and ask your question, and then let him speak. And I think, I mean, Peter, you can decide how you want to do it. I mean, it seems like. And we'll find how it goes. I mean, some questions lead to another question, which lead to another question. It leads to sort of a back and forth, back and forth. You'll have to decide if you want how you want to deal with that.
Yeah, and comments are very welcome also. It should be more of a conversation.
Okay.
Than me being the big expert.
So Bev has a question. Bev, go ahead.
I wonder if you can gauge the level of mental distress that comes from people like you and me sitting around and listening to all of this. It's clear to me, and probably to many people, that if you're a victim of hurricane destruction or wildfire destruction, or so many other manifestations of climate change effects, that you're going to be seriously bummed out. But what about people who are just reading the paper and talking to other people and hearing bad news?
Well, it's so tied up in with the COVID thing and the political situation. I don't know. It's just hard to sort out all those things, isn't it? But I mean, we're all pretty depressed. It's been a really, really bad year. And every time I prepare this talk, I feel more and more down that, you know, we've really done nothing. We wasted 4 years. You know, we had this critical time when maybe we could have done something, and we've done, as far as I can see, almost nothing. And, you know, I know Michael Moore's latest movie, I can't remember the name, but, well, it's not really his movie, but he sort of has promoted the movie. And their point of view is that you can't engineer your way out of this problem. There's not an engineering solution. It's got to be a political solution. And I don't see any people coming forward that are really going to be able to do something as radical as we need. I don't think it's going to happen. John, you've got to unmute yourself.
Yeah, okay, there you go.
I'm here. Peter, thank you for the presentation. I noticed that everything was global. And you noted we're having local effects. I wonder if there are any specific things that we can do locally about disease vectors or other specific encroachments that we're beginning to experience, or is it really all a macro issue?
Well, you know, I mean, there are certain things you can do about the disease vectors to protect yourself, obviously. You know, here, I mean, at the present time, it's mostly about ticks, right? And there are things you can do to protect yourself against tick-borne illness. But, you know, and also when malaria finally gets here, with the breakdown of the public health system, which is going to occur. I didn't really mention the whole problems of wars and security, but the U.S. military has been pretty outspoken about the disruption of the political systems that this is going to create around the world. I mean, Syria, I guess, is sort of the tale of that, and Somalia, and Libya probably as well. But I don't, we can protect ourselves from some vector-borne illnesses, but I just think that's a very small part of it.
Thank you.
Hank, I have a question.
So I'm sorry, was that Barbara?
Yes.
Yeah, so Barbara, could you wait a moment? I see that
Sure.
Karen had put her hand up in the, so I wanted to go in that order if we could.
That's fine. It's just that you can't see me raising my hand, so that's why I interfered. I'm sorry.
Oh, okay, that's okay. Either way, so you could go, or Karen, do you want to ask your question?
Go ahead, Karen.
Okay, so it's not a question, it's more a comment. Getting back to sort of what we were talking about just a minute ago in terms of people like us, we see how bad things are and we get depressed. And what do we do about it? Well, what you do to combat the depression is you have to be active. And whether that is working to get out the vote, working in campaigns for people who are, have good proposals in terms of climate change and what to do about it. That's really what you have to do, I think, you have to be active. If you sit around and just mope and say, and throw up your hands and say, oh my God, this is terrible and there's nothing we can do about it. Every little bit helps. And the more people that are doing their little bit in their little corner of the world, that's helpful. And I really think, getting out the vote for legislators that could make a difference, I think that's super important, and especially right now. For instance, Sierra Club has a letter writing program, and anybody can get involved in that. It's letters that are going to possible voters in the swing states who they have seen have interest in the climate, and it's to basically get out the vote with these people. So, I mean, there's just a million things that people can do, and I think being active is the way to combat depression.
Thanks, Karen. I think we all need to hear that. Absolutely.
So, yeah, thanks, Karen. I agree totally with you, by the way. Barbara, you want to?
Thanks, Peter, for the presentation. I'm curious about the Physicians for Social Responsibility in Maine. It's a national organization, first of all, right?
Yes, that's right. Yeah, we have a Maine chapter.
So is that a political force? Do you have an office in Augusta or, things like that? Or is it a small group of people who are agitating within the national group of physicians? I'm trying to get a bead on how immediately active you are in terms of Maine.
Well, we have a half-time staff person, Karen DeAndrea, who works very hard, and the board is about 8 people right now, and we have I think 600 or 700 members in Maine of course, it's a national organization. We're a chapter of the national organization, but
Yeah.
I think we do have, it's a small organization, but nonetheless, we have a staff person. It's not all volunteer. So we try and advocate for the bread and butter issues that PSR has always advocated for, which is nuclear disarmament, but climate change, environmental toxins, intimate partner violence are important issues for the organization as well.
It's definitely good to have a staff member. That says a lot right there. Do you have anybody on the Climate Council?
No, we don't have anybody on the Climate Council, no. Mm-mm.
Do you think there's any possibility of making your views known within that context?
Well, I think a lot of us have done that as individuals. But the Climate Council was named by the governor, so they're basically people in government, and also there are only a couple of people from any kind of nonprofit organization in the Climate Council. If you look at the membership, it's a pretty conventional membership. You can't really nominate yourself. So I don't think the membership is going to change at this point. Would anybody else like to comment on the Climate Council?
I could. This
Go
is
ahead.
Karen. The Climate Council has a lot of public meetings that anybody can join on Zoom to find out what they're up to. Also, the Maine Conservation Voters has very frequent webinars where they have Climate Council people. And the Climate Council is constantly soliciting the general public for their input. They have to come up with a climate action plan by December 1st, but they sent out surveys some time ago. So a lot of us filled out those surveys. I think they had 4,400 people fill out the surveys, but they still are, you just email them and you can have some input. And actually, there is a coalition of nonprofit climate action groups like the Natural Resources Council of Maine, for instance, who they've come up with what they think are the most important policies to advocate for. So there is still chance for input into the climate, the Maine Climate Committee Council, and there is also plenty of input from nonprofit climate action groups. I think there is some hope there. They have addressed some of the medical aspects of climate change. I wouldn't be quite as down on them as Peter tends to be. But I mean, if, the more that the general public communicates with them, the better. That's the point, is that people out there have to talk to the people in government and let them know what our concerns are. And the more people that get in touch with them, the more they pay attention. So that's what I'd say.
Thanks, Karen. That was great.
Yeah, Bev?
I would just like to say that the youngest member of the Climate Council is on your right. She's a recent graduate of the College of the Atlantic, and she represents the voices of youth on the Climate Council, and she's reaching out to various groups within the state. She's currently doing a short internship with the Maine Sierra Club. And I think she is very receptive to hearing from people and passing along the message to the rest of the council.
So this is Karen again. So Peter, in order to join PSR, would we just go to the website and sign up?
Yeah, that's all you need to do, sure.
And you said that there are several hundred people in PSR in Maine?
Yeah, I think we have at least 400 members.
Wow. But PSR is not super active politically or otherwise at this point? Is that true?
Well, we're as active as we can be, but we're a small organization. I think we're quite active.
Yeah. Yeah. I guess going to the website, you'd find out what the projects are that PSR is working on.
Yeah, there are 4 areas of emphasis. One is nuclear disarmament. The other is climate change. The third is toxics. And then the fourth was domestic partner abuse, which we haven't been very active in the last couple of years, but we had a grant to do that and until about 2 years ago.
And do they do any lobbying in the legislature?
Yes, we have
PSR?
a staff person on a regular basis, sure.
Okay, well, I'm going to join up.
All right, that's great. Good. Go ahead, Bev.
I have a question about PSR and other groups that do the kind of work you do. Do you have coordination with groups like the Maine People's Alliance and groups of people who might be dealing with some marginalized communities? Because we know now that some people in the most marginalized situations are some of the ones who are most affected by all kinds of environmental degradation.
Absolutely, it's a huge issue, and we work in the statewide coalition with basically all the progressive groups. Sure, absolutely.
Great.
Joe, yeah.
You're
on
gonna
mute.
have to unmute yourself, Joe. I
You're still
can't do it.
Did I?
There you
Yeah.
go.
Good. Okay. I was just going to put my own personal positive spin on a couple of things that we were talking about here globally. And that, first of all, there's an election here in the United States. And when things swing so far to the right and out of control, the pendulum tends to swing back. I think it may swing back for a lot further than some people are going to like. And that may be true in the UK and in Hungary and in Brazil and some of these other countries that are being affected either with wildfires or hurricanes and all the other disasters we read about. And I think that this committee wrote a letter about the correlation between climate change and the COVID virus. And how even though it was hard for people who were dealing with the virus and the changes personally that was happening to them and their businesses, we thought it was important that we got our message out that this is something to consider. This is a small change that a large change that's happened to all of us, but it's only the tip of the iceberg when it comes to climate change. And the correlations that are there are pretty obvious to a lot of people. So I'm optimistic that things may change for us and the world pretty quickly. And the other one's just a personal note on how to not stay depressed, because I understand that reading the news every day. And Sharon and I, the answer for Sharon and I is to exercise. We walk around this bay every day, And it does two things, not only, and sometimes we pick them up and sometimes we don't, but you know, walking around the bay, exercising itself is wonderful. But the second thing is seeing the beauty of Penobscot Bay. It can reinforce the reasons why we need to stay attentive every day.
Thank you, Joe. I agree. We also clearly need to care for ourselves as best we can, you know, and exercise, and yeah, caring for ourselves are ways to stay strong in the face of our challenges.
Yeah, I'd like to make one more comment about the Climate Council. I mean, all of that has to be translated into legislation, right? And it depends how the election works out. You know, if very progressive people are elected in November, then, you know, maybe some of those things will actually be enacted. Otherwise, all bets are off. But I'm with Joe. I think there is going to be a big swing to the left, hopefully, or maybe I should say a big swing to the center.
Progressives.
Yeah.
Could I ask one more question, Hank?
Yeah, sure.
Peter, you showed a slide that showed that heat was the biggest problem in terms of deaths globally.
No, that was in the United States.
Okay, in the United States. Thanks for that. So I'll say my question is, a bit ago you talked about ticks as being the big problem in Maine, and I understand exactly why you said that. We don't think of Maine as a hot state, but we have had a lot of drought this summer. In September, we had big drought, and before that we had a drought that I understand was the longest one in 150 years as calculated by MAFCA. So my question to you is, have you looked at any data that gave you an indication that heat is going to rapidly become a problem in Maine, where we don't expect it really?
I don't think anything is going to happen rapidly that way, but I mean, the heat deaths in Maine haven't really been an issue, but in the big cities like Chicago, for example, which has a very similar climate, they've had a lot of heat-related deaths. It has to do partly with the urban environment. You know, people are living in this massive concrete jungle, which is just radiating heat. Everybody's running the air conditioners and forcing heat into the environment. And the elderly people who live in cramped quarters in big cities are the ones that are dying of heat-related illness. And not having big cities in Maine, I think, is a big factor as well. Plus, the one big city we have is on the ocean, and that obviously cools things off a bit too.
Well, Chicago is on a large water body.
Yeah, yeah.
So
It's the windy city too, but they've had a lot of heat-related deaths in Chicago. Somebody else in the group might know more about it than I do, but Chicago's been a problem.
yeah. Okay, thanks. I just wanted to get that question in.
There are parts of the planet which are just going to become unlivable. As I'm sure you saw, the temperature reached 130 degrees in Death Valley, but it's regularly been up into 110, 120 in the Middle East. And the Middle East is rapidly becoming unlivable.
Yeah.
Yes. Yes.
Phoenix too.
Yeah.
This is Karen again. Peter, do you have a sort of an overall impression of what kind of tick-borne illnesses you've actually seen in your practice?
Yeah, we see almost as much anaplasmosis as we do Lyme disease. We test everybody for all the tick-borne illnesses now. We haven't seen very many cases of babesiosis, but we've seen a few. And then what makes that different is the treatment is quite different. So it's important. Doxycycline doesn't work for it. So it's important to try and diagnose that.
Dr. Millard, for our audience, maybe you could flesh out just a little bit more then on when the average person that finds a tick on their body, how important is them to get to their physician or to an ER? Is it just symptoms, or should they arrive and have a professional decide?
Well, if it's a deer tick, which if you look it up and you look at the images, you can pretty much find something that's a deer tick. And if it's been on, if it's been on and had a blood meal, then you should probably take prophylaxis. That's doxycycline as a single dose to prevent Lyme disease and possibly anaplasmosis.
Thank you.
Bev.
Could you explain anaplasmosis and how it differs from Lyme disease?
Well, it's a different kind of bacteria. It's a rickettsia. So, and it's a fairly severe illness. You know about Rocky Mountain spotted fever. Or typhus. It's a cousin of those two diseases. So it's fairly severe. It hits you like a brick. You get high fever and shaking, chills, and nausea, vomiting, headache. So whereas Lyme disease, you're pretty sick with Lyme disease, but when you have anaplasmosis, it's hard to miss. Of course, we can't really differentiate that from other diseases by symptoms. That's why testing is so important. And unlike Lyme disease, we can actually do a DNA test. So we'll pick up the DNA of the bacteria so that we can make a diagnosis that's more rapid.
What about equine encephalitis and dengue fever? What other sorts of creepy things could be moving in our direction?
Those definitely, yeah. Dengue and chikungunya, and potentially also malaria in the future, you know. Definitely. We have plenty of Anopheles mosquitoes in Maine.
Yeah.
We have a question here, Doc.
This is Sharon, sort of lurking on the side of Joe, wondering what makes, you'd mentioned earlier in your presentation about the Lone Star tick, and one of the things it could do is you might become allergic to red meat. That sounds very peculiar. What's the mechanism for that?
I don't know, but there's no question that it happens.
Wow.
All right, well, seeing no further comments or questions, I think we should wrap it up. But it's been a pleasure to talk to you all, and nice to see some old faces and some new people too.
Yeah, thank you, Dr. Millard. Thank you for this. This was really great. We appreciate it.
Thank you for inviting me, Joe.
Great meeting you.
All right, you too.
Thanks, Peter.
All right. Take care, everybody.
Thank you, Peter. Thank you, Hank. Thank you, Joe.
Thanks, Brenda. Thanks, everybody. Good job.
Okay. Bye-bye.
Bye-bye.
So long.
Bye.